Hey, Deliberate Leaders, I'm your host, Jen Dreen, Executive Business Coach at Deliberate Directions, where we are dedicated to helping leaders build strong, thriving businesses. And each episode here on Deliberate Leaders podcast, we bring inspiring interviews like the one we have today to help you on your leadership journey. Today, I'm interviewing Mark Stinson. Mark has got a very diverse background, but he talks about himself as a healthcare brand innovator. And specifically, we'll be talking today about his book, Patient Activation. And he also does a lot of branding, advertising, marketing strategy, specifically in the fields of health, science, and technology. Welcome, Mark.
It's great to be here, Jen. Thanks a lot.
You bet. So you have, like I said, just a super diverse background. You're author of several books, it looks like, worked on everything related to branding and marketing that seems like you could get into. Do you want to tell us a little bit about your history?
Well, branding and marketing for sure. And then I think the second half of that is what you were describing, the focus on healthcare, pharmaceuticals, medical devices, all sorts of healthcare procedures. And I think the combination of those two is really a personal mission to really raise the awareness for new medical treatments, but also maybe accelerate for the companies their ability to get those treatments out and let more people take advantage of them.
Yeah, I think it's such an important topic. And, one of the big reasons I wanted to invite you on here today was to talk about that. As you know, I am an optometrist and I own private practices. And so, but I'm also a health coach that specializes in healthcare and helping doctors run their practices better. And I'm
Exactly.
sure you can remember from your background, there was actually a lot of years where it was illegal for healthcare practices and healthcare industries to market. And so now that we've kind of gotten to the point where we're allowed to do that, none of us know how. We don't have training, we don't have background, and
Yes.
we're expected to operate like businesses, but still healthcare. And there's different dynamics that go into marketing and branding, that for sure.
For sure. And just like anything, yeah, the pendulum swings back and forth a little bit. But we're certainly in the era where you can really think of us as healthcare consumers. And, some healthcare professionals might bristle at that and say, I don't really want to have consumer or customer experience or service. I want to treat patients and so forth. But really, when you think about it, treating the patient right is a customer experience. And that's really the kind of message we wanted to get for both sides, for patients and for the healthcare professional in this book, Patient Activation, to really help everybody communicate better.
Yeah, I think that's a great idea. I'm glad you've written a book on it. So kind of based on that, what based on your title, what does it mean to you to be an activated patient?
Yeah, so Bob Bowers is the CEO of this company, 83 Bar, and he's my co-author on this book. And he and I collaborated on this term, patient activation, that it's not simply maybe patient awareness or patient education or even patient engagement. These are well-known terms in the healthcare fields, especially in practice building. But we really wanted to think of it from the patient's point of view and say, it's one thing to be aware of a new treatment. And certainly you see a commercial on TV every night for a drug or a treatment or some new procedure. There's no lack of awareness, if you just kind of read about these things. But we really wanted to say, past awareness, what's going to make you get up off the couch, click a button on the internet or make a phone call the next morning to actually learn about something and be educated about it, and then take the next step to get a doctor's appointment. And of course, again, many people who deal with medical practices know that getting the appointment is sometimes the biggest hurdle. If you have something that's really on your mind, you want to take care of it right then and there. And so when you're motivated, that's when we said, well, let's activate and try to, bring the deal together, get the patient into the office and let the two meet.
Yeah, absolutely. Do you think that activation can be defined or measured in a specific way?
Well, what we were interested to find, it was not just an attitude. You didn't just feel activated. There were actually metrics, and they're called PAM-13s, patient activation measures, and there's 13 statements. And to the degree agree or disagree with these statements is what makes you or defines you and measures you as an activated patient. So things like, do you feel personally responsible? Or do you feel like you can talk to your doctor? Or do you feel like your doctor has your best interest in mind? And so all of these questions give a scale, and give a measurement to how activated you are and how you feel as a patient.
And in terms of the kind of that measurement, do you suggest that practices implement those surveys on their own, or do you feel like is there a way to do that on a higher scale through outside companies?
Yeah, I think if you wanted to start at the very beginning and say, we're going to have our antenna up to listen for these kinds of things, that's a good start. But if you wanted to go all the way, like many practices and many larger health systems do, is that we're really going to measure how educated, aware, activated, and how, much implementation of our recommendations patients actually take. Because as you know, again, compliance and following the doctor's instruction is a big hurdle. So, how much is the patient actually using this doctor advice and following the prescriptions and so forth? So, yes, they can be implemented in a very formal way, but we should all start and at least say, let's ask the question and let's listen to each other.
I think this is a fantastic measurement tool in terms of what it's measuring and the impact that it could have on the healthcare industry in general, right? So we've got all these measurement systems now, like MIPS, I think is the most current one, right? And really what they're doing is they're measuring the quality of the care, but they're measuring the quality of care based off of metrics within practice management softwares and reporting of doctors. And it's not based on patient experience and patient activation, right? And I think that when we look at how we can help patients, which is the purpose of what we're doing, right? Getting their feedback is the most important part. It's not just about the doctor's feedback and what test we ran or didn't ran. It's really, if we only got them to do one thing,
Yes,
and
yes.
that would be the most impactful for their life and their quality of life, their healthcare, what would that be? So I can definitely understand why having patient activation and measuring that in a really specific ways more valuable than some of these other measurements maybe that the government and the industries are
Well,
requiring at this
exactly.
time.
And you're saying, how well is the healthcare being delivered? And that's obviously important. But
Sure.
it's also how well is the brand, is represented. And so we often use analogies like retail or restaurants. And there's basically two questions that you can ask. A, would you do it again?
Mm-hmm.
Would you buy from us again? And then two, would you recommend us to a friend?
Yeah.
So look, even at your local coffee shop, they will ask you a survey after you go, or your oil change or what have you, that says, how satisfied were you with the service? And would you recommend us to a friend or family?
Sure.
And those two metrics have been proven to be very, instrumental or projectable even as to how your experience was.
How does this system of measurement relate to the NPS score, the Net
Yeah.
Promoter Score?
Well, and that NPS is exactly what I was describing,
Gotcha.
is that, how well was your experience delivered? And then
Right.
how likely are you to refer to a friend? And those metrics. And so you could put your medical practice, you could put your, pharmaceutical program next to retail, restaurants, car service, right on down the line and say, where do we fit in?
Yeah, absolutely. Do you find that the healthcare industry has different scores for these metrics than other industries, or are we kind of shooting for the same type of metric or the same level, right?
Yeah, well, interestingly enough, and this is a whole chapter in the book, Bob likes to call it the priming of the patients. But Amazon Prime has changed the way we all think. And so if you go into a retail store and say, sorry, we're out of that, well, I can buy it online. and I'll have it not in a week, not in 2 days. I might have it that afternoon, depending on where I live, right? Or
Yeah.
I can go back to the store. And I find that very interesting that you go to a store and they say, we don't have it, but I could order it online, come back to the same store and pick it up tomorrow. But that conversation isn't happening. So we said, look, in that context, if you tell a patient who wants to have a, and I'll just pick a specialty. I want to see a rheumatologist. I want to see a gastroenterologist or any medical specialty. And they look at the calendar and they say, we can see you on October 17th. Yeah, it's like, I don't want to wait 12 weeks for something that I've got on my mind right now.
Right.
Or if you ask, how much is this MRI going to cost? And it's like, what do you mean? We're not used to thinking about the cost of particular healthcare services. And
Hmm.
so while many things do have a price tag, a lot of times it's like, well, it depends on your insurance. Well, does it really? The MRI costs what it costs. So
Sure.
how much you have to pay for it out of your pocket might be variable. But so these things that are kind of a black box in healthcare that we've let go. The premise of the book is that patients now are more empowered and are more activated, and we should be ready for those kinds of questions.
I think the impact it can have on some of the huge negatives. You mentioned like the wait time just to get in to see a provider right now because of the shortage of providers or barriers that we have, right? And in healthcare. And I think that, using these metrics as a tool to implement change into the healthcare system, I think could be pretty powerful too. I definitely see from, perception of branding and marketing, but also, just implementing change in the healthcare industry as a whole could be pretty powerful.
Absolutely. And I think we've seen, if all of a sudden out of a pandemic, we know what telehealth really is. I mean, it was there, but it wasn't really there. And
Hmm.
so now you would have to ask, well, why would I be driving downtown to the University Medical Center when I could talk to you right here? I don't
Yeah.
have to leave my house. It'll cost probably half as much. Now, of course, if I have to have a test, if I have to have blood drawn or have a diagnostic procedure, well, then that's not going to fly. But, I could have the pre, I could have the post, I could do a lot of things. And this is what Bob and his team at 83 Bar that we document in this book is that telehealth has now really changed the game. The conversations, the access, the availability, the comfort level, because now all of a sudden I'm not in a hospital gown sitting in a strange environment, with my blood pressure up because I was waiting in the waiting room. I'm at
Hmm.
my home, we're sort of equals now. The box on the Zoom is the same size. We're
Yep.
having a conversation as equals. And I think that again gives the patient more empowerment to have a meaningful conversation with the doctor. And hopefully it gives the doctor a chance to be more, relatable.
Yeah,
And,
absolutely.
and this is the same with nurses. And there are more call centers, more telehealth nurses. Again, having a empathetic, you know, kind of conversation and
Yeah.
caring a lot more.
Well, and I think using this as a tool for you, like you said, that telehealth has been big, and I think that's one of the great things that's come out of out of the pandemic is having some of these changes come up, right? And knowing what those boundaries are. But I think that, like you said, like a lot of these services have been offered for a long time. But I know we enacted laws in Idaho, which is where we're at, like 5 years ago on telehealth.
Mm-hmm.
And they're just, they really haven't really been pursued by the general public. I think mostly for a lack of awareness. And so getting the word out in these ways
Yeah.
is fantastic. So
Yeah, and you can't say, okay, everybody has high-speed internet now and everybody has a Zoom camera and everything, but it is a lot more universal than ever before. And
absolutely.
so you can't say, this is like all of a sudden you realize you could order your groceries and go pick them up. Well, you could do that, 20 years ago, let
Yeah.
alone 10.
Yep.
So, but now these things are a lot more accessible and a lot more just everyday
Yeah.
practice.
So you mentioned that you co-authored this with someone from 83 Bar.
Yes.
And what is the process that 83 Bar uses?
Yeah, and I think one of the things we were trying to document in this book together was that there's a 4-step, first you have to locate the patients and connect with them. They're searching online, you're searching for them. How do you get together? And then
Mhm.
there's the education step. And so you're not just aware that there's a new treatment, or even in some cases, a new clinical trial. How many people know about clinical trials as an option?
Yeah.
So it's a lot more, available to more and more people. And so that's another level of education. And then I think the third step is the navigation part. Can you get me an appointment? What doctors in my area should I go to? And provide a choice. Again, you can do this with a zip code. Are there 3 practices in your area that you might want to consider? And then all of a sudden you say, well, yes, I do. I have a sister who goes to that practice. Maybe I should try them too. And then the fourth step is to really advocate for the patients and to let the patients advocate for themselves. Again, in the age of Yelp, I'm making all these connections to all these other tools that we use on an everyday basis.
Yeah.
But, the Yelping of healthcare practices is something that, again, has been out there, but it will become more and more a reality. So, how well you're treated, right down to did they have anything to look at in the waiting room, or was
Mhm.
it a timely visit, or did I sit in the exam room for a half hour waiting? All of these things will come back.
Yeah. I think that's one of the, being private practice owner and doctor, like that's one of the things that, we send out surveys after every interaction with a patient. And when patients send us feedback, we respond to them, and they're,
Mhm.
within a week is our procedure. We want to make sure that we follow up with them in a timely fashion and we address their concerns, and they're always shocked that they're getting called back at all. And they're like,
Right.
what, you actually read this? Like,
Right.
it's
You're
not
from
just
the
for
doctor's
fluff.
office? Yeah.
I know. And so they're always really shocked, which I think really helps. But you're right. Like one of the metrics that we follow in our practice is actually how many Google reviews we have.
Yeah.
And that's just, we hope they're all great. We can't be the perfect doctor for every patient, right? But I think that having that awareness out there, people often come in and tell us that they came to see us because of our Google reviews.
Hmm.
And they decided to schedule an appointment from Google
Yes.
because of the Google reviews. And so I think that they can't be ignored. I think a lot of healthcare practices, especially smaller independent practices, are not paying attention to that as much as they should be, for sure.
Yeah. And I think, again, it's like surveys are so common, but I had done a program with Ritz-Carlton many years ago, and people say, oh, you take a survey, we got a 7, you know. Well, at Ritz-Carlton, anything less than a 10 is practically a 911 emergency. They didn't give us a 10, so we need to address it. And the fact that you're saying at your practice, you call people, whether it's a 9, 8, 7, or we don't wait for a 1 and a 2 where somebody's in a crisis and had such a bad experience, they gave us a bad review. So yeah, talk and listen and absorb it and make the changes necessary.
Yeah, absolutely. And I think that that's the follow-up, right? Listening to what the patients say, good or bad, and responding to them so they feel heard and empathized with, and then implementing the change in your practice or your healthcare industry, right? And that's really the biggest part, is like, okay, this is something we've heard. How can we implement change to make sure that this doesn't become feedback we get repetitively, right? Like, obviously we did
Yes.
something. How can we do better next time? And so,
And you really underscored, and I thought I would just highlight what you said, is like, I really feel heard.
mhm.
You listened to me. And that was the thing in our market research. We're following up on this book, hopefully with another one very soon, based on market research of what you were talking about. How much do you feel heard? Because the average medical visit is like, I don't know, 7 minutes or something like that. And so
Yeah.
how much communication and conversation can you have? So did the office staff listen to me with my questions? Did the nurses listen to me? Did the doctor listen? And was there any follow-up, as you were talking about, to see how I felt about it?
Mhm.
So there's a lot of listening that needs to be done. And I think what we hope to continue to pursue in the research with the 83 bar team is how well people are listening.
Yeah, yep, absolutely. So how has the company changed over time, especially in response to the COVID pandemic with 83 Bar?
Yeah. Well, one of the central things that we've just been talking about was the telehealth, and a major offering of 83 Bar was this contact center that was staffed by telehealth nurses uh, to educate. They're not obviously the patient's nurse, so they're not, dispensing medical advice by any stretch of the imagination. But because they're trained as nurses, but they also have, empathy skills, soft skills, emotional intelligence,
Sure.
they can have meaningful conversations with the patients and then say, hey, if this is something you want to pursue and move forward with, we can get an appointment for you. So almost concierge like. And so this company has really built a foundation. It's a software, data-driven kind of company with these empathy, people skills layered on top of it. So it's been fascinating to watch the company move and grow.
Yeah, that is interesting. I like the idea of having that concierge type service for that, right? I think, like you
Yeah.
said, like the average doctor's visit anymore, healthcare provider visit is only 7 minutes, right? And so having that feeling even of having like that one-on-one and that specialty service, I think is valuable to patients. And as a health care consumer myself, I know that's something that I look for when
Mhm.
when the medical industry goes above and beyond what I think it should be doing. I make sure to make it known because it's not common. So it's good to hear that there's a blend there.
Yeah, it needs to be elevated. And I guess we always try to flip it on the other side too and say, what is the benefit to the doctor of having a more educated, activated patient? Well, then you're going to have a lot more productive conversation. I can't blame the doctor for the 7 minutes. I mean, that's what they got.
Yeah,
Um, but if you're not having to go through the 700 meaningless questions from a Google search,
sure.
I printed out my Google and it's
Yes,
you
Dr.
know
Google said this. What do
Dr.
you have
Google
to
is a
say?
very busy doctor. No, so
Very.
it makes it a more relevant and meaningful conversation. And so we think about it from the doctor's point of view too. We're not just saying, can we create more powerful consumers to make the doctor's life harder? No, quite the opposite.
I think that's a great point. And I think that, having patient activation, like you said, does do both of those things. I think that we talk about the healthcare industry and the number of doctors that are getting burnt out um, and stopping to practice and then leading to shortages in healthcare providers. And then a lot of that comes from those timeframes that we're expected to see patients in and making sure that we do give them the perception that they're being heard and that they felt listened to and that we've addressed their concerns. But there are a lot of ways that we can still do that in a really meaningful way. And
Yes.
because there's paraprofessionals like nurses and,
Mhm.
all these other providers, utilizing them in a very powerful way to be heard, through that way the doctor's skill set that only the doctor can do is being addressed at the time with the patient.
Yeah,
And like you
there you
said,
go.
making it meaningful.
Yeah. And you
So
think about the last line of every one of those drug commercials that you'll see on TV tonight is ask your doctor if it's right for you.
yes.
Well, if you've gone all the way to make the appointment, wait for the appointment, wait in the waiting room, wait in the exam room, and finally you say, is it right for me? And they say no. Well, you've wasted a lot of people's time,
Yeah.
including your own. I mean, you've driven, you've parked, you've made the appointment.
Right.
But what if it's not right for you? So why don't we have the conversation with the nurse or with the telehealth professional before you get to the doctor, being another benefit to the practice.
Yeah, absolutely. All right. Well, what is next up for you? Are you, or you kind of mentioned that you may be leading into another book or something here in the future?
Yes, well, based on the experience of patient activation, Bob and one of the other partners at 83 Bar, Sue Hiram, published two additional books, one on fibromyalgia and one on pre-diabetes, focusing on, what does it take to be an activated patient in these conditions. But as I also mentioned, we're doing some additional market research to really understand the patient's call it psychographics. We can measure a lot about age and other demographics, but what about the psychology of the patient and how they get to be more activated? So we hope to be completing that in the next few months and then publishing a new book too.
Oh, fantastic. That
Yeah.
actually sounds thrilling to me. As being a background in psychology prior to my optometry career, I love the understanding why people do what they do, right? And one of the things that I learned going into being an entrepreneur was, people buy things because of an emotion that they feel like they're going to get from that, right? And that's all psychographic. It's not demographic, right? I mean,
Yes.
sure, the demographics play a role, but understanding who you're working with and how they like to be motivated and how they like to be spoken to is really going to help encourage that activation on just a whole new level. So
Yeah. And one of the biggest lessons learned, not only in this healthcare field, but just in my branding and marketing and market research experience overall, is you can't trust your own gut assumptions always. You say, well, people all love this. Just what? Because you like it? It's like, no, I think you'll be surprised. So that's why we want to do the market research. So, based on, 100 of thousands of calls that 83 Bar has fielded over time. Well, what have we learned from all those phone calls? And if we could actually put some rigor behind measuring that and reporting on that, I think it will be a great report.
yeah, absolutely. Well, great. Thank you so much for connecting today, Mark. And how can people connect with you online? What's the best way?
Absolutely. Well, the book is called Patient Activation, and the subtitle is The 4 Steps Proven to Move Healthcare Consumers from Awareness to Activation. It's available on Amazon and other book resources too. And then the company is Go83Bar, B-A-R, go83bar.com.
Perfect. And what about you? Can they connect with you on LinkedIn?
Absolutely. Connect with me on LinkedIn. And I have a personal website, mark-stinson.com, where you'll find all the other books that you were referencing at the beginning.
Awesome. Great. Thank you so much for your time
Yeah,
today.
thanks for having me. I enjoyed it.